Thanks for inviting me to speak today, and I'd also like to thank UNRISD, the co-sponsors, and my fellow panelists. I'd like to start by telling you just a little bit about the Sexual Rights Initiative and the kind of work that we do. I work with Action Canada for Sexual Health and Rights, and the title is pretty self-explanatory. We're a partner of the Sexual Rights Initiative, which is a coalition of 6 organizations from all regions of the world that come together to advocate for the advancement of sexual rights at the Human Rights Council. We are explicitly feminist in our approach, and we intentionally use the term sexual rights with the understanding that in its broadest form, sexual rights refer to the human rights of every person to have control over and decide freely on all matters related to their sexuality, reproduction, and gender. This means that we work on a broad range of issues from an intersectional perspective, including abortion, early and forced marriage, sexual and reproductive health, violence against women, gender identities and expressions, and so on. The SRI has been engaged in several areas of the Council's work since its establishment in 2006, and has witnessed significant advances in this time. To be sure, there have also been setbacks, which unfortunately we tend to remember more than the successes. But the overall trend has been to move towards greater recognition and acceptance of sexual rights. This is reflective of the positive developments that are taking place at the regional and national levels, which in no small measure are the result of persistent and sustained advocacy from civil society. For example, since 1994, more than 30 countries have liberalized their abortion laws. Landmark regional political agreements have been signed in Africa and Latin America and the Caribbean on comprehensive sexuality education, adolescent sexual and reproductive health. More women and girls have access to modern methods of contraception than ever before, and new HIV infections are on the decrease among adults. Governments certainly deserve credit for passing the laws and adopting the policies, but we know that it is the people who build the momentum, are very creative in their advocacy, and pressure their governments to recognize their rights. With the rise of fundamentalisms, the crackdown of civil society, the fierce backlash against women's rights, there is a climate of fear right now that we are facing the possibility of going backwards on sexual rights, even as we still have so far to go. The gains that were so hard fought are at risk of being lost as states literally trade away our rights to have control over our bodies in exchange for a better trade deal, or to score political points, or in response to dangerous waves of populism creeping into our societies. In these challenging and highly politicized times, it is important to remind ourselves of the collective achievements of the sexual and reproductive rights movement that has always operated in the face of opposition and constant attacks, that change is possible, and to never underestimate the determination of sexual and reproductive rights advocates who know all too well that the personal is political. So with that in mind, I'd like to highlight one area in which the Council has shown tremendous leadership and has influenced the global agenda, and this being the area of maternal mortality and morbidity. In 2000, when the MDGs were adopted, discourse on maternal mortality and morbidity did not include women and girls. This sounds counterintuitive, to be sure, but even with the ICPD Program of Action, Beijing Platform for Action, countless CSWs and CPDs, maternal mortality was largely considered a target, a number to reduce, exclusively a health system problem. There was no real discussion about the context of women and girls' lives, the impact of multiple forms of discrimination on their ability to access information, education, and services, and certainly no real mention of accountability. Unsurprisingly, the rates of maternal death did not decline as fast as was expected. In 2007, civil society fought hard to have a new target for universal access to reproductive health added to the MDGs, which was a massive achievement and improvement, but it wasn't enough. And MDG 5 remained one of the most off-track of all the MDGs at the conclusion of the agenda. While this was happening in New York, over here in Geneva, the Special Rapporteur on Health at the time, Paul Hunt, was working on his report on the relationship between the right to health and the reduction of maternal mortality. This report, combined with the work of the treaty bodies, a broad and committed coalition of civil society organizations, and leadership from a cross-regional group of states, spurred progress that was slow but steady. The first UN resolution recognizing that maternal mortality and morbidity was a human rights priority was adopted in 2008. This was a really big deal because finally the links were being made between women and girls' human rights and maternal mortality. The resolution was followed by OHCHR reports, expert group meetings, more resolutions, and in 2012, the publication of the technical guidance on applying a human rights-based approach to this issue was published. Over the years, the analysis has gotten stronger. Women and girls were moved from being passive victims of a terrible tragedy to being active agents in their own lives and the policy-making process. The importance of fulfilling sexual and reproductive rights became more prominent, and mechanisms for accountability were identified. The technical guidance has been disseminated around the world, has influenced the global strategy, the first one and the most updated one, the establishment of accountability mechanisms for these global strategy, and resolutions at the GA, and also the SDGs, of course. And the technical guidance is being used now by civil society and states to find real solutions. The international community now accepts maternal mortality and morbidity as a human rights priority, and that violations of sexual and reproductive rights and gender inequality are the drivers of this global issue. Just yesterday, at the panel in room 20 on this issue, panelists, states, and civil society took the floor to publicly state their support for women and girls' sexual and reproductive rights. Abortion law reform was openly discussed, and welcome words of women's and girls' rights to bodily autonomy echoed throughout the chamber. The progress on maternal mortality and human rights has been informed by and has also contributed to significant developments at the normative level. Some recent notable examples include the adoption last year by the SESCR Committee of the General Comment 22 on the right to sexual and reproductive health, and the CRC Committee's adoption of the General Comment 20 on adolescence. The special procedures continue to produce contextualized analysis of sexual and reproductive rights in their annual reports, their country visits, and their statements. And just to name a few, the special rapporteurs on health, torture, violence against women, culture, and the working group on discrimination against women have all done incredible work. And just to mention that the working group on discrimination against women, their report last year on health and safety and the instrumentalization of women's bodies is outstanding, and I would recommend everybody to read it, especially states. The underlying theme in all of these documents is a conceptual and analytical framework that is based on evidence, not ideology. It places increasing emphasis on bodily autonomy, demonstrates the linkages between sexual rights and other human rights, and identifies entrenched gender norms as the root cause of most of these violations. This framework provides a valuable blueprint by which we can understand and effectively advocate for greater attention to and accountability for sexual and reproductive rights. The UPR mechanism of this council continues to be an important accountability mechanism for sexual and reproductive rights. It provides a space to raise issues that are neglected in most policy spaces, for national civil society organizations to hold their governments accountable, and to demonstrate some global trends in this area. So just to give an illustration, in the first 25 sessions of the UPR, there have been 157 recommendations on abortion, 377 recommendations on early and forced marriage, 2,825 recommendations on gender-based violence, 723 recommendations specifically on sexual violence, 231 recommendations on maternal mortality, and 62 recommendations on sexuality education. We know that these commitments don't always translate into concrete actions, that implementation of progressive laws and policies is slow and often problematic and under-resourced, that states can say one thing in room 20 and another thing in the negotiating room. But it is important to pause and take stock of these incredible achievements, to pay tribute to the people who contributed to these processes over many, many years, and resolve to resist any attempt to roll back our sexual rights. We must also remember that most people do not occupy this privileged space, that sexual rights violations are not just a matter of language, but of life and death for people in many countries, and that people subject to marginalization, discrimination, stigma, and violence because of their sexuality are the ones most likely to be left behind. So we must redouble our efforts to make space for the voices that are not being heard, to build upon the strong foundation that we have, and insist on moving forward with this unfinished agenda and work in solidarity with all of those who share a vision of a world in which all persons can exercise their rights to have control over their bodies and their sexuality, free from coercion, discrimination, and violence. Thank you.